In this video, we will talk about what I consider to be one of the most important characteristics of cardiac myocytes. At the end of this video, you should be able to answer the following questions. Why is the absence of satellite cells a problem for cardiac myocytes? What is the difference between myocardial ischemia and myocardial infarction? What are the symptoms of a heart attack? What does a heart attack do to the heart? What do we mean when we say exercise is cardioprotective? And what do you have to do to experience the cardioprotective effects of exercise? At this point in your college careers, you should already be familiar with the similarities and differences between cardiac myocytes, or cardiac muscle cells, and skeletal muscle fibers, or skeletal muscle cells. One of the key differences between these two muscle cell types is that skeletal muscle fibers have satellite cells, and cardiac myocytes do not. Satellite cells give muscle cells the ability to grow and repair themselves. This is something that gives skeletal muscle fibers an impressive ability to grow and fix themselves when they are damaged. Since cardiac myocytes don't have satellite cells, they are limited in their ability for growth and repair. This means that when an area of the heart dies, it is dead forever. This dead area is no longer able to conduct electrical activity or contribute to the force generation required to squeeze blood out of the heart. The lack of satellite cells in cardiac myocytes becomes an issue when someone has a heart attack. Before we go into heart attacks, let's review a few things you should already know about cardiac myocytes. First, you should know that cardiac myocytes are constantly contracting and relaxing. In fact, these cells contract and relax in a coordinated manner that causes the heart to beat 60 to 100 times per minute in a typical resting human. This constant activity requires a constant supply of ATP, as ATP is required for both the contraction and relaxation of muscle cells. This ATP demand is met through the aerobic energy system. In order to supply the heart's aerobic energy system with the oxygen and nutrients it needs, blood needs to be delivered to the cardiac myocytes. The coronary arteries are the blood vessels that are responsible for delivering the blood that gets used by the heart. If someone's cardiac myocytes are not able to get enough oxygen and nutrients because of a partial or full blockage of one of their coronary arteries, we say that patient is experiencing myocardial ischemia. If blood flow through the blocked coronary artery is not restored, it may create an area of myocardial infarction, or an area of dead cardiac myocytes. A heart attack is a sudden severe blockage of the coronary arteries leading to the death of the tissue. Please pause the video here to review the symptoms of a heart attack. If you notice these symptoms in yourself or someone else, you should call 911 immediately. It is important to call 911 immediately if someone is experiencing the symptoms of a heart attack because treatment delays can make damage to cardiac myocytes more likely and may increase the area of damage. As mentioned earlier, this dead area isn't able to contribute to the electrical or contractile activity of the heart. Now on to the good news. Participation in regular aerobic exercise is cardioprotective. This means that it can reduce your chance of having a heart attack and increase your chance of surviving a heart attack. Doing just 60 minutes a day of aerobic exercise for 3 to 5 days is all you need to experience the cardioprotective effects of exercise. This level of physical activity is associated with a 60% decrease in the amount of the heart that is injured by a heart attack. It is worth keeping in mind that the reversibility principle of training applies to aerobic exercise. So it's a good idea to make sure that you do aerobic exercise on a regular basis to maintain that cardioprotective effect. If you don't continue exercising, you will lose the cardioprotective gains you have made. Now that we have reached the end of this video, please take a few minutes to make sure that you can answer the questions posed at the beginning of this video.